Hey guys, Lacey here. I just want to give you a little video to talk about depression in pregnancy. So it's important to know that if you have a history of depression or anxiety before pregnancy, you're more likely to experience it in pregnancy. And if you experience it in pregnancy, you're actually more likely to have a postpartum disorder of mood, most likely postpartum depression. And also, it's good to note that in pregnancy, untreated depression is actually linked to higher risks of preterm birth, small for gestational age, stillbirth, or low birth weight. So, knowing those risks, what can you do? It's important to focus on getting good, healthy sleep, as well as understanding that nutrition and hydration have a direct impact on your mood. It's also been shown that DHA, which is an omega 3 fatty acid, has also been shown to help with depression. But it's important to note that this form is not recommended as the only line of treatment if you are having depression. So let's talk about treatment options. When you're looking for treatment, that includes like care in your pregnancy or seeking other treatment for depression. It's important to make sure that that provider has an education and training in trauma-informed care because it has been shown to have a positive impact on your mental health. One of the therapies that are recommended is called cognitive behavioral therapy. This is also known as CBT therapy. And this has been shown to have a direct impact on the relief of symptoms of depression. There's another type of therapy called EMDR therapy. This is based on a bilateral involvement of your brain, which means it's engaging both sides of your brain through usually a series of like eye movements, and the therapist kind of walks you through a guided tour of like how to look and where to look. And the idea is that involving both parts of your brain can help you process traumatic events, which could be leading to depression. Currently, CBT and EMDR therapy is the only therapies that are recommended for PTSD in the prenatal period, and many times PTSD is a cause of depression as well. There's also the other option of medications in pregnancy. The most studied medication in pregnancy for depression is an SSRI. And there are some side effects that have been shown from taking SSRIs. This includes like a postpartum hemorrhage, miscarriage, preterm birth, low birth weight, and small for gestational age. However, as we discussed before, these are also the same risks that are associated with having depression. So it's kind of hard for studies to analyze and really pick out what's actually causing these symptoms, and there could be a lot of overlap. But overall, it's been generally considered safe for medications due to the effects that untreated depression has on pregnancy. And so it's important to talk with a provider about like the risks and benefits of any treatment option when it comes to depression or not treating the depression and what that would look like. And it's important to have follow-up care with depression and regularly visit the treatment that you are doing and seeing if it's working and reevaluating your steps. Some other options also are remembering that it's important to practice self-care. This can look different for everyone. And self-care can be challenging when you're having depression. It's hard to find time to do things that you want to do. It's good to have activities that you really enjoy, but it's also good to have downtime where you can just sit with your thoughts and practice mindfulness, which has been shown to help with depression. As well as there's an option of life coaches. They're somewhat like therapists, but they more help you identify areas that you want to work on. It can be in combination with having a therapist as well. But life coaches have been shown to have a positive impact on reducing symptoms of depression as well. The most important thing is to reach out to those that you trust and find support for your depression and pregnancy.